Are you suffering from neck pain and tension and looking for strategies to get some relief? Do you have neck pain or tension with dizziness? I'm going to share with you my secret trick that I teach my patients to use and I use myself along with my husband to treat neck pain or tension on our own at home. It's important to address neck pain or neck tension as part of a comprehensive approach to addressing dizziness or vertigo. That's how I practice in my method. That's what I recommend to my friends and family. I'm Dr. Kim Bell, your vertigo detective. I'm a doctor of physical therapy. I specialize in dizziness and vertigo. And just to remind you, this is not individual medical advice. I am going to be talking about a specific product that I use, my husband uses, we recommend to our friends and family, and many of my patients use. But I don't know what kind of allergies or skin conditions that you might have. So before you choose to buy this product that I'm going to share about today, as part of my secret trick, make sure you read the ingredients and talk to your doctor to find out if this is right for you. This channel exists to offer information, education, and hope. Okay, let's get into it now. So first of all, pain or stiffness in your neck can be a sign of localized inflammation. Frequently, patients that have dizziness related to their neck will tell me that if they take an anti-inflammatory medication, like a non-steroidal anti-inflammatory, such as ibuprofen, Advil, Aleve, something like that, then their dizziness will go away. This is one of the signs that you have an inflammatory component related to the dizziness because the anti-inflammatory medication may help. Now, fine point here is that's not the case for everybody, depending on what's wrong with their neck. Sometimes it's not inflammation. Sometimes it's actually structural, muscle trigger points, other things like that. But in many cases, it's inflammation in the neck that is contributing to dizziness or vertigo. So pain or stiffness in the neck may be a sign of localized inflammation. Some patients with dizziness from their neck may have a history of whiplash. They may have a forward head posture. They may have some kind of pathology in their neck that's identifiable on an X-ray or MRI, such as maybe a disc herniation, a pinched nerve, something like that. So they could have a neck pathology. In my practice, I say you don't have to have a neck pathology. This person with neck-related dizziness may use the computer a lot. Perhaps they don't have good ergonomics, like hunching over a tablet or reclining all the way back in bed with one pillow under their head to read on their phone, for example. So poor ergonomics on electronic devices can contribute to dizziness from neck pain or tension. You could have what we call tech neck, which means you kind of hunch over your smartphone a lot during the day. And so it's that rounded forward posture that can contribute to the neck pain or tension that causes dizziness. Some people may have hobbies or occupations that require them to spend hours rounded forward working, such as throwing ceramics, making jewelry, being a woodworker, some kind of a musician. So different types of hobbies or occupations can cause people to have to round forward. And so those are all different reasons why people may have chronic or recurrent inflammation in their neck. So I'm going to give you my secret trick now that I use myself for this problem. I have taught my husband, my family, my friends, and I recommend to my patients as long as they don't have allergies or skin problems that preclude them from using this cream. So let me show this to you. This is called Tea Relief Cream. My former personal trainer told me about it. This stuff is a miracle. I put it anywhere that I have pain when I get out of the shower. This one I'm showing you is extra strength, which they say offers 50% more ingredients, more relief. I have found when I use the extra strength version, for me, I can get completely rid of any pain. If I use the regular strength version, I get about 50% relief. So I've upgraded to the extra strength because I want to feel as good as I can. And then also, I used to use the cream version of this, Tea Relief Cream, but I found out it has soy in it, and I'm allergic to soy now. So I switched to the gel. The gel also dries faster, so I can get dressed faster after my shower when I put this on. However, the gel does contain alcohol. So I know some people have to avoid alcohol. They may prefer the cream, which takes longer to dry. But then if you're allergic to soy, you don't want the cream, maybe you go with the gel. So those are just some advantages and disadvantages of using this. I'm going to show you how I apply this so you can see my secret trick at work. So what I do is just get a little bit on my finger, like the size of a dime or a nickel, and then I just rub it, especially here right behind my ear. Okay, so right in there behind my ear. I personally put it here on my cheek because I have some TMJ kind of issues that contribute into my dizziness. So I rub it on my cheek, right in front of my ear. I rub it down around behind the ear. And sometimes I go all the way around my ear, okay, because of my TMJ problems. Then I'll come down like this on my neck and do the front of my neck. This is my sternocleidomastoid muscle. I'm going to do that area. I'm going to put the cream here. Okay. I'm going to go on the side of my neck, which are the scalenes. I'm going to go on the back of my neck from the base of my skull all the way down to the tops of my shoulders where I carry a lot of tension back here. And then switch to the other side. And again, I'm going to put the cream here behind my ear, on my cheek. I'm going to come down here on this sternocleidomastoid muscle. So it goes from the ear. You can see it down here. I'm going to put it all on there, on the sides of my neck, the back of my neck, all along the hairline, tops of my shoulders, for me, my cheeks, and I'm going to come up and around the top of the ear. So if you don't have problems with your TMJ or like your jaw doesn't click and pop around when you're chewing and stuff like that, then maybe you don't need to go around the ear like I do. So the cheek and the top of the ear for me is more for my jaw issues. But if your issue is just pain like behind your earlobe and stiffness when you turn your neck, then maybe you just put the cream behind the earlobe and down from there. Okay, and then not everybody needs the cream in the front. If you don't have, when you sit here, if you kind of give yourself a little very gentle, tiny little pinch on the front sides of your neck, if there's no pain in there, then maybe you don't need any cream here. And again, I don't know if you need this or not. This is just how I instruct my patients. So take it or leave it. Talk to your doctor before you try any new products in case you have an allergy or in case this isn't right for you considering your other medications or creams or health issues. I don't know your personal story. So I'm not saying you specifically, I'm saying you as a general term when I teach my patients how to use this cream. The scalenes are on the sides of the neck. Many patients have tension in the scalenes. And then at the base of the skull here, it's called suboccipital muscles. A lot of patients with dizziness have tension along there. And that's why they get those base of the skull headaches. So, I mean, if you can even put lotion or cream up along the hairline there and just kind of rub it into your hair. And then it goes all the way down to the tops of the shoulders where we hold a lot of tension. So what do I use this for? I use this for localized inflammation in the neck that's contributing to pain or tension. And the reason I use it is, first of all, to try not to get headaches, to try not to get dizziness or vertigo, and then to address the pain or the tension or the stiffness that's from localized inflammation. But this doesn't take the substitute of professional medical care. I still go every week or every other week, depending on how I'm doing, usually a couple times a month to get my neck treated by someone who specializes in spinal care for the upper cervical area. And so I do regular health care. This is just a secret trick I use day to day to try to live my best quality of life. So now I'm going to show you, as promised, where you can find a link to that particular product that I just shared. You can just type Vertigo Detective into your browser and this will come up. Then go here to the store, click on the store. And then these are my most recommended products to my patients at the very top. You can click right here. This is the T-Relief Extra Strength Gel. And that's what I just showed you that I use for neck pain or stiffness to prevent headaches and relieve dizziness or vertigo. It helps me function from day to day. It helps my husband. It helps many of our friends. It helps many of my patients. Again, I'm not saying it's right for you because I don't know your individual circumstances, but I wanted to share with you that secret trick because it's made my life better. I hope this video was helpful. If you got anything out of this, please like the video, subscribe to my channel, and drop me a comment. Let me know what else you want me to talk about as I'm starting to make videos more regularly. I'll see you in the next one.